Shigella is a gram-negative enteric that causes gastroenteritis, specifically leading to bloody diarrhea. As if diarrhea weren't bad enough. Well, Shigella sonii is by far the most common in the US, so that's generally what we'll be talking about. We're going to call this drawing She-Gorilla Circus. So let's get started. Here's our gorilla. I have to admit, I'm no Jane Goodall, but I'm having a little trouble telling that this is a she-gorilla and not a he-gorilla. So let's add a tutu. We've made the tutu green for a reason. Shigella forms green colonies when plated on Hecto and Auger. Hecto and Auger is a great way to differentiate Shigella from Salmonella. Salmonella grows black colonies, as we mentioned in our last video. Another important comparison to Salmonella is that Shigella is immotile. So we'll chain our she-gorilla to this weight. She-gorilla, you're not going anywhere. You should also remember that Salmonella was acid labile, which meant that you needed to ingest a ton to increase the chance that a few survived the acid in your stomach and would then go on to cause infection. Well, acid doesn't phase she-gorilla, not one bit. She-gorilla is acid stable. To prove it, we'll draw another she-gorilla circus performer walking a tightrope over a pool of acid. You need to have ridiculous stability to do that. So since Shigella is acid stable, it needs far fewer microorganisms to cause infection, more on the order of 10 to 100, as opposed to the 10,000 Salmonella would need. So now that we know that once you ingest Shigella, it really easily gets past our stomach and into our intestine, now I'm going to talk about its trip from the intestinal lumen to invading the intestinal mucosa and causing an infection. In our intestinal epithelium, specifically in Peyer's patches, we have these cells called M cells. M cells are like scouts. They sample things in the lumen and bring back antigens to the immune cells on the other side of the intestinal epithelium. Shigella induces M cells to phagocytose them, and then they escape from the phagolysosome before they're degraded. Once in the cytoplasm, Shigella uses the host cell's actin cytoskeleton to create a tail that it can use to propel itself from one cell to the other. In a way, this is similar to the actin rockets used by Listeria. I think this is so cool. It's like they load up an M cell like it's a Trojan horse, break past the guards, and once inside, they use the enemy's own weapons against them. To represent all of this, we'll show she-gorilla shooting herself out of a cannon, and this will represent Shigella's ability to use actin filaments to propel itself. And then we'll show her flying down and about to land on this big pad with an M on it, and this will represent invasion of M cells. So since Shigella can survive both on its own and inside another cell, it is facultative intracellular, just like Salmonella. Once Shigella has invaded the lymphoid tissue and enterocytes surrounding the M cells, it damages tissue and releases cytokines which can trigger a large immune response. Clinically, this means we'll see fecal blood and leukocytes, which means you're dealing with an underlying inflammatory diarrhea. To represent bloody diarrhea, we have a recurring symbol that we'll use in all videos in which a bug causes bloody diarrhea. We'll paint the stool that she-gorilla is sitting on red. So red stool stands for blood in the stool, or bloody diarrhea. To illustrate the inflammatory nature of the diarrhea, we'll draw flames all around she-gorilla. Don't worry, this is all part of her act. So we've made it clear that Shigella causes bloody diarrhea. But there's another concern, especially in a child with shigellosis. If they're infected with a strain of Shigella called Shigella dysenteriae, there's a chance that the infection can precipitate hemolytic uremic syndrome, or HUS. Although it's fairly uncommon for Shigella to cause it, it's more commonly associated with the type of E. coli that we'll talk about in another video, it's still testable. So if any young patient in a question stem has a prodromal diarrhea, and a week or so after, just as things are looking up, just as they're starting to get better, they present with signs of acute renal failure, think HUS. So how does HUS work? Before I explain, let's draw out some more so I can really visually represent it. So we have she-gorilla spinning plates on a stick as she's holding some red balloons that look suspiciously like red blood cells. Meanwhile, this child, who's the ringmaster, is whipping and popping one of the balloons. Now let me explain it all. So once Shigella invades, as I've shown you earlier, it can release a toxin called Shiga toxin. When it gets into our bloodstream, the toxin can induce endothelial damage, including within the glomerulus of the kidney, via a mechanism we don't need to know. To indicate the glomerular damage, we have the whip tangled up into a knot that looks like the glomerulus. This damaged endothelium activates platelets and causes their aggregation, meanwhile diminishing the pool of circulating platelets, thus leading to a drop in platelet count. and this is illustrated by Shigella spinning the plates. Finally, the aggregates of platelets protruding out of the endothelium lyse red blood cells as they pass by, literally sometimes cutting them in half so that they look like helmets, or schistocytes. This hemolysis of red blood cells is shown by red balloons being popped by the whip. Finally, we chose to make the ringmaster a young boy, indicating that HUS most commonly occurs in patients under 10 years of age. And this should give you a pretty good understanding of the pathogenesis of HUS. As I said earlier, you don't have to know the mechanism of how Shiga toxin causes HUS, but you do have to know the toxin's mechanism of action in damaging tissues. Shiga toxin binds to the 60S subunit of ribosomes and inhibits translation. So to remind you that it inhibits the 60S portion of ribosomes, we'll add this hourglass. It's a timer for this really intense circus act involving whips, flames, and broken plates. They only have 60 seconds to complete the act before the gorilla burns. So since this hourglass is a timer that lasts for 60 seconds, we'll write 60S on it. And this should be a solid reminder that the toxin binds to the 60S subunit of ribosomes. And we've come to the last piece of information. Just like Salmonella, Shigella utilizes a type 3 secretion system to secrete inflammatory cytokines. Instead of giving the ringmaster a microphone, we'll give him a turkey baster. This way we'll represent type 3 secretion system the same way we did in Salmonella. And that wraps up Shigella.